Let me give you an example. The most popular vaccine in the world is the DTP vaccine, diphtheria, tetanus, and pertussis. It was introduced in this country around 1980.
In 1948, scientists combined pertussis with diphtheria and tetanus toxoids to form the DTP vaccine. Widespread use of the DTP vaccine almost eliminated the diseases by the 1980s.
That vaccine caused so many injuries that Wyeth, which was the manufacturer, was said to the Reagan administration, we are now paying $20 in downstream liabilities for every dollar that we're making in profits, and we are getting out of the business unless you give us permanent immunity from liability.
A 1982 TV news report entitled Vaccine Roulette suggested that the whole-cell pertussis vaccine was the cause of permanent brain injury. Subsequent studies indicated that while the whole-cell vaccine was associated with febrile seizures, it was not associated with long-term brain damage. However, those studies took at least 10 years to exonerate the vaccine. In the meantime, as vaccine manufacturers were flooded with lawsuits, some decided to stop making vaccines rather than face continued legal pressures. Consequently, production dropped, leading to concerns about vaccine supply and subsequent vaccination rates. By shielding vaccine manufacturers from liability, Congress assured that future generations would be protected from devastating diseases. A common misconception is that this process completely shields vaccine makers. However, a plaintiff may file a civil court claim against vaccine companies after filing a claim in the Vaccine Injury Compensation Program if they reject the vaccine court's decision.
These then were given, and by the way, Reagan said at that time, why don't you just make the vaccine safe? And Wyeth said, because vaccines are inherently unsafe. They said unavoidably unsafe. You cannot make them safe. And so when Reagan wrote the bill and passed it, the bill says in its preambles, because vaccines are unavoidably unsafe.
The preamble to the National Childhood Vaccine Injury Act of 1986 is a statement of the Act's purpose. Nowhere in the document does it say vaccines are unavoidably unsafe. However, there is language in the Act that uses the word unavoidable. It states that no vaccine manufacturer shall be liable for unavoidable adverse side effects. Examples of side effects are swelling or redness near the injection site, fever, loss of appetite, feeling tired, and vomiting.
And the Brucewitz case, which was a Supreme Court case that upheld that bill, uses that same language. Vaccines cannot be made safe. They're unavoidably unsafe. So this is what the law says. Now, I just want to finish this story because this illustrates very well your question. The DTP vaccine was discontinued in this country, and it was discontinued in Europe because so many kids were being injured by it.
The DTP, whole-cell pertussis, vaccine was largely discontinued in the US and Europe in the mid-1990s, with a more effective and safer acellular DTaP vaccine being licensed in the US in 1991 and recommended for routine use by 1997. While specific dates of discontinuation vary by country in Europe, the global shift from DTP to DTaP began around the early 1990s. The primary reason for switching from the DTP to the DTaP vaccine is the significant reduction in side effects, particularly fewer fever and neurological reactions, associated with the acellular pertussis component in DTaP compared to the whole cell component in DTP.
The only medical intervention that does not undergo placebo-controlled trials prior to licensure of vaccines, not one of the 72 vaccines that are now mandated for our children have ever undergone a placebo-controlled trial prior to licensure.
Vaccine manufacturers in the United States are required by law to conduct extensive testing under the strict oversight of the Food and Drug Administration. The FDA Center for Biologics Evaluation and Research establishes and enforces regulations throughout the entire process of vaccine development, testing, manufacturing, and post-market surveillance. The laws governing vaccine testing can be found in the Public Health Service Act, Federal Food, Drug, and Cosmetic Act, Pediatric Research Equity Act, and the National Childhood Vaccine Injury Act.